and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, incidences of breast cancer are on the rise in the country. What is even more disturbing is that a lot of deaths due to breast cancer could have been avoided by diagnosing the disease in its early stages. So, to discuss and know more on it, we have with us in studio Dr. Pankaj Deka, Senior Consultant Gynecology, Health City Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Thank you so much, Dr. Pankaj Deka, for coming to Good Life, the health show. So, the topic which we have taken today is breast cancer. And which is very much prevalent and being seen in women these days. So what is all about? What are the signs and symptoms? So at first, what would you like to tell our viewers?
Thank you, Pooja. First of all, we are here to discuss about the breast cancer today. And it is a topic actually all the women should know something about. The more because of the incidence of the breast cancer, which is actually at a rise. And if we have to go back for last 20 years data, then we can see that there is a almost twofold rise in the incidence of the breast cancer.
Okay.
In overall, worldwide, it is around 21 lakhs of women, they are affected with breast cancer in a year.
Okay.
And out of that, around 6.2 lakhs, they died because of the breast cancer. And the same incidence almost reflect to India because some time back it's thought that the breast cancer is a disease of Western world, but that is actually not true.
Okay.
And the incidence in India is also equally rising, and India almost around 24 per lakhs of women. If we consider 1 lakh women, out of that 24 are suffering from breast cancer. And the death rate actually, the more alarming fact is that the death rate in India is much more in the world.
India is much more than the world. Okay.
Almost 30, it's 12.7 in India per 1 lakh population. Out of 24 who diagnosed with a breast cancer, 12 are dying because of the breast cancer. That is more alarming.
Okay, that's rather concerning as well. So, which is the age group we are talking about, doctor? Which is the age group which is mostly affected?
Generally, what is book teaching is that it is a disease of the elderly age group.
Elderly age
group. That is say around 55 to 64, that is the most prevalent group. Okay. But in India, what we have seen is that because we have to follow the Indian data, in India it's almost 10 years earlier. That's say around from 45 years till the 60 years. These are the period where the incidence is quite high.
Okay.
But I have found in my practice is that even the lady, or I can say the girl of 25, 27 years, they are also suffering from breast cancers nowadays.
Okay, very
so
young
it's
age.
very difficult to define a particular age. The peak incidence is in between 45 to 60 years. But yes, even the younger women, younger girl, they are also suffering from breast cancers nowadays.
All right, we'll talk more on this, like what the age group which you were talking about, and what kind of like age group do you get in your everyday practice. So let's get a phone call. It's on the line. Hello.
Hello. More actually working woman. Our baby at the 3 months or 4 months old baby girl. It's actually feeding to more 8 hours, 9 hours man diya nohoy. So hetu kane more board kiba effect koribo pare niki?
Okay.
Okay. Now question to there is a gap of around 8 years. Moi bhabu je working women যেতিয়া হেতু এটা ডিফিকাল্টি হয় কিন্তু 8 আৱাৰ্ছত বেলেগ একো প্ৰবলেম নহয় the only problem হ'ব পাৰে যে breast engorgement হ'ব পাৰে because of the retention of the milk যদি মিল্কটো তাত থাকি যায় ব্ৰেষ্টৰ অলপ engorgement হ'ব পাৰে but what I suggest by most of the working women they do is the express the breast milk in between if you feel like যদি আপনি টান হোৱা নিচিনা দেখে তেনেহলে এক্সপ্ৰেছ কৰাটো ভাল otherwise definitely কোনো bad effect নাই but yes you should continue the breastfeeding at least till the 1 year of age of the baby because it's beneficial for you continuing the breastfeeding.
It's beneficial for both the baby and as well as the mother as well.
Yeah.
So doctor, this is also a very good question which the viewer has just put on, that 8 to 9 hours if she is a working woman and she won't be able to feed her baby. So that might also cause some problem for women, and which option which you have given is rather than that, what can be done?
Yeah, I mean that is what actually sometimes because of the working woman it's not possible for her because in our country there's no such a kind of crash and all available. Those are available that I can understand. But what the focus should be, the baby should get the breast milk, exclusively breast milk on the breast milk for 6 months.
Okay.
After that only we can give some top feed, and it gives the benefit to the baby in terms of immunization and prevent some diseases also, that also. And secondly, it gives some protection to the mother against the breast cancer.
Okay.
What we suggest is that the breast cancer is beneficial for the woman because the incidence is at a rise, and more so in the metropolitan area, like the highest incidence in Delhi, Chennai, followed by Bengaluru, because most of the women, they are working there. And as a result of that, this working culture and all, because they give birth less number of child, one maximum two child, and also less breastfeeding.
Okay.
Not exclusively breastfeeding, maybe 3 months, 4 months, or sometimes some women do not follow the breastfeeding at all. So when a woman gives the breast milk to her child, because of the sucking reflex, there are some hormones releases, and that gives some protection to her against the breast cancer disease.
Okay.
So it's always beneficial to continue breastfeeding at least for 1 year. At least for 1 year.
So that's indeed very much beneficial for the
Yeah,
mother as well. So we were talking about the age group which is mostly affected, and you also mentioned about 25 years of age who you have come across. So is it only the number which you have come across recently, or it has been like prevalent from the past as well?
Not very past actually. Recently, what I have found in last 2-3 years, I have found 2-3 cases of very young girl or young woman, they're coming with the breast cancers. And if we have to discuss the etiology of the breast cancer, what causes the breast cancer,
Okay.
then it goes that there are some factors which are modifiable and some are non-modifiable.
Okay.
And if you go to the modifiable factors, those and first I like to discuss about the non-modifiable. They are mostly some genetical factor. There are some hormones or genes, rather I say genes. They are responsible for breast cancers, and some of the genes like BRCA1 and BRCA2, these are most technical words, but they runs in family.
That's inbuilt actually.
Yeah, inbuilt. So almost 15% of the breast cancer, they are because of the familial hormone, this hormonal effect, this genetic effect, BRCA1, BRCA2. And there are some other factors like advancing age, and then racial factors. Some white women, they are more prevalent to the breast cancers. All these are some non-modifiable risk factor, but there are some modifiable risk factor where we can do something.
Okay.
And those modifiable factors are mainly the use of hormonal pills. That sometimes causes breast cancer.
Okay.
And we also have to understand that there are some lifestyle factors like obesity. It contributes to the breast cancer. Then also some other factors like use of alcohol, smoke. All these are the factors which we can change those factors, and they ultimately lead to the breast cancer.
Okay. So the lifestyle is also playing a major role in these kind of diseases as well. And if we talk about women nowadays, they are very much busy, and the lifestyle which they lead is a working woman. If we talk about a working woman and they don't get proper time to have their proper food as well, and maybe a proper rest. So is anything related to stress or something, doctor? Any kind of like causes which is related to stress as well?
Yeah, definitely. Actually, stress, what it causes, that there's an imbalance of hormones. Imbalances of hormone because of the stress. And in our body, everything is followed, controlled by hormone. What I have to say is that everything is controlled by hormone, and there has to be every hormone has two parts. Either if it have to balance in between. If increases also, it causes some harm, and if there's less production also, then also there is harm. So we have to maintain that balance. And in case of stress, those balance disturbed. So definitely stress and busy lifestyle. And what suggests is that night work, if woman has to work for prolonged hours at night, they also contributes to the breastfeeding. Definitely it's related to some stress factor in her.
Absolutely. So if we talk about the risk factors of breast cancer, so which is the major risk factor we would like to tell our viewers at this point in time?
Yeah, definitely the major risk factor. First, I have to suggest that a familial factor. Family, if there is any history of breast cancer in the family, say her mother or her some cousins, aunt, or maybe some first-degree relative, any of the first-degree relative, if they are suffering from breast cancer, there's a high probability, almost 30 to 40% chance that she will also get the same gene and she will also suffer. So definitely, if there is any family history of breast cancer, we have to follow the screening protocols from almost 10 years before a normal person. 10 years before the normal
Right.
person. Yeah, this is the main factor. And other factors are, I have to say in our terms, the parity is the number of children.
Okay.
Number of children. If there is less number of children, late age of her marriage, and third is the breastfeeding. Breastfeeding actually it gives a lot of protection against the breast cancer.
Okay.
So risk factors I have to discuss. Then these are the breastfeeding, then familial factor, then lifestyle, as we have already discussed about the life factor, and there are some drugs. For the general people it's a drug, for us it's the hormone. Sometimes we have to take some contraceptive pills and all. Some women they continue the pills for prolonged period, but in a pill,
so that also causes,
that also causes. So any contraceptive pill you have to under supervision of some doctors, actually at least for some consultation about the benefit and side effect of the pills, because sometimes prolonged use of pills, the hormonal pills, they will also lead to the breast cancer.
All right, viewers, we are indeed having a fruitful discussion and the numbers are flashed on your television screens. So if you have any queries regarding the topic which we have taken today, that is breast cancer, so please call up and ask a question. Dr. Pankaj Deka from Health City is in our studio and he will probably give you all the answers and he'll try to give you the answers which you would need it. All right, doctor, if we talk about the breast lumps, so are all the breast lumps cancerous? So that is also a common question being put by the women out there.
Yeah, actually, breast lump, this is one thing that most of the women fear about, the breast lump. And even the very young girls in their menarche age, they feel some sort of lump. But what I have to suggest is that all breast lumps are not cancerous. Even most of them are benign condition. There is a two condition called fibrocystic disease of the breast and fibroadenoma of the breast. So most commonly, most of the young women, what they come with the breast lump is the fibrocystic disease or fibroadenoma of the breast.
Because they are concerned what kind of lump it is. So it's better to see a doctor.
Yeah, better to see. But yes, definitely we also don't do much of the intervention in those case of lump. Only have to follow is that those benign lumps are very much mobile.
Okay.
Very much mobile. It is very difficult to catch the lump in her breast. It almost moves like a mouse. So if those kind of character of the lump, then I think no need to worry. But still, what I suggest to consult your doctor. But yes, mobile lumps, they are generally not cancerous.
Okay. Now, a self-examination is also a part where a person can make out that what kind of problems or she's facing. So, if we talk about the self-examination, doctor, how a girl or how a woman will do a self-examination?
Yeah, this is a very valid question actually, what I like to discuss in all shows, because first I would like to highlight what is the benefit of self-examination. Breast cancer is a disease which can be, there is only few cancers where screening is possible. Screening means diagnosis of the disease in a very early stage or in a pre-cancerous stage. That is called screening. And breast cancer, cervical cancer and oral cavity cancer, these are the three cancers where the diagnosis is possible through screening.
All right, doctor, we'll come back to that discussion. We have a phone call. Let's take the phone call first. Hello? Hello? All right, the line got disconnected. We'll try to patch again. So we were talking about the self-examination part.
Screening. That is what called screening. Screening. This is very important because if the woman practices the screening examination of her breast very regularly, she can detect a very small size of lump.
Okay.
Small size of lump in a very early stage. And for that, what she needs to follow is that there should be one monthly examination of her breast.
Okay.
Monthly, she should fix one date. Either it should be in the first week of any month, every month. What I suggest, and it should be around 7 to 8 days after her periods, because before that period or during that period, the breasts are tender. It's very difficult to examine the breast.
Okay.
And so 7 to 8 days after her period, she should fix one date. After her period, she should fix one date and examine thoroughly both the breasts. All
right, doctor, we'll come back to that. We have the caller waiting for us. Hello.
Yes, I just wanted to know that what causes breast cancer? Like, what are the main reasons behind it?
Main reasons behind breast cancer?
Yeah, if I have to discuss the main reasons, I have to suggest that what is disappointing is that 70% cases we don't know the exact reason why the breast cancer is there. But secondly, what already we discussed regarding the familial factor, genetic factor mostly, then some hormonal issues and some lifestyle issues also there, and other factors are are like less number of child, less breastfeeding, all these are the risk factor for the breast cancer. We have to discuss the risk factor. Exact cause we don't know. In 70% cases, there is actually no risk factor. Even without the risk factor, the breast cancer is there. But in 70%, in 30% cases, these are the risk factor. Obesity, then some sort of use of contraceptive pill, all these are the risk factor for breast cancer.
All right, thank you so much for calling. I'm sure at least you must have got some idea about what the question you have put to Dr. Pankaj Deka. Okay, doctor, we'll continue with the discussion, but we'll have to slip into a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching a Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Pankaj Deka from Health City Hospital on the topic breast cancer. All right, doctor, coming back to you again. Earlier to the break, we were talking about self-examination, which is very important for every woman to know about it. So please proceed with it.
Yeah, that is what. We have to fix one date, most probably 7 to 8 days of her period.
Okay.
And then we have to spend at least 5 minutes with both her breasts. The ideal procedure is to just take the middle 3 finger and examine the breast starting from the nipple areolar region circular wise, and cover the area from all the area from the collarbone, that is the beauty bone here, until the rib cage down. Okay, this whole area you have to examine in a circular manner, clockwise or anti-clockwise, right around this or that side. And secondly, you also don't forget to examine the armpit.
Armpit?
Yeah, armpit is actually part of the breast only.
Okay.
So most of the time we just don't discuss or don't know about that, ignorant about it. That we can't avoid this or you can leave left behind this armpit because there is a breast has a tail and it extends to the armpit.
Okay.
So the whole area constitute the breast. We have to starting from the sternum, this bone from here up to the armpit, and from the collarbone to the rib cage. The whole area you just examine every monthly at least 2 to 3 minutes per breast. So with the benefit of this that even a small lump can be detected by the woman herself because breast is her organ and she has to know her organ properly. And if you continuously examine the breast, then even a small changes she can detect very early and she can approach her doctor for that.
So is it the only lump that been seen in the breast or also in the armpit, which we are talking about? That is also an important part that has to be checked thoroughly, isn't it?
Thoroughly.
So if there is a lump in the armpit, what has to be done, doctor?
And one more thing I just like to highlight, she has to examine her nipple area, pressing her if there is any discharge from the nipple. Unless she is breastfeeding, there should not be any discharge from her nipple. And if there is any discharge, that is also at some point she should discuss with her doctor. And the armpit, if there is any lump or any irregularity, gland kind of thing is there in the armpit, she should follow her, because any gland generally sometime with the inflammation and infection, gland may occur there. But if these are increasing in size or there is a tenderness, a painful lump, painful glands, then she should some concern with that. Okay,
so this is very important and everyone should know about it. All the women should know about the self-examination. I'm sure the process which has been shown by Dr. Pankaj Deka, that's very easy, and you have to just fix the date of every month and then you can examine it, you can self-examine it, and if you find any kind of problem or any kind of lump, you can immediately see a gynecologist, isn't it, doctor? All right, now let's talk about the role of mammography, what it is about and what the viewers should know about it.
Mammography actually is a one of the advanced screening tool.
Screening tool.
Screening. The self-examination, there is a 3 part of this breast examination. One is the self-examination. The second is by examination by the clinician or a doctor. And the third is the mammography. Mammography. What is important is that we should combine everything together. Like in our hospital, Health City, we have a breast clinic. This is a dedicated hour for the women to discuss about their breast issues.
Okay.
So there are some, every hospital actually.
So there is a consultant.
Yeah, there's a
that can be
consultant
okay.
is there, and he will discuss only regarding the breast issues
Okay.
during those hours, breast clinic. Sometimes most of the women, they approaches to the breast clinic discussing a lot of problem, not about the cancerous problem, but there are some benign problem
Many
also.
basic problems
Many
as
basic
well.
problems. Sometimes they find difficult also to discuss all those, but in the breast clinic we can discuss. And if there is any suspicion or anything after the clinical examination by the doctor, then we generally advises the mammography. Mammography actually is a simple form of X-ray, X-ray of the breast. X-ray of the breast, and in our hospital in Health City we combine along with that ultrasonography also.
Okay.
Ultrasound along combined with the X-ray. So it gives a very clear picture about what is going on in the breast.
What is the problem?
What is the problem?
There is any kind of problem there.
And there is a definite guideline after the age of say 40, women should do once in a year. She should do one mammography.
Okay.
Mammography. Actually, the benefit is that any early changes in the breast, it can detect by the mammography. And
well, we have seen in our day-to-day activity, and also to the women, like there are a lot of women also that this is a term, this is a topic which is been shied by many of the people. They shy a lot. They don't come up easily to talk about it unless and until they find a major problem in it. Now, see, if there is some kind of pain in your breast, so is it all kind of pain dangerous, or is it, can we talk about it as a risk factor as well, doctor?
Actually, what I suggest is that already discussed, the breast is a hormonal, it's a hormonal or endocrine organ actually. It secretes a lot of hormones. So with the hormonal changes in the body, according to her period's date, actually, there are some changes in the breast also. And most of the time, before the periods, breasts are tender. Before the period, breasts are tender. And most of the women, they feel, sometimes some of the women, they don't feel, but still it's tender breast. But those tenderness aren't a natural physiological process. These are nothing much to worry about. But yes, if there is associated with some lump or there is some skin changes over the breast. Sometimes what happens, we can see the skin of the breast like pewdy orange. In our technical term, it's a pewdy orange, means the peel of the orange. Yeah, if there is some spot, some retraction of the skin, and along with that there is some sort of tenderness in the breast, then yes, definitely some alert.
Now, if we talk about the cancer facilities in Guwahati, I'm sure the viewers must be they must be eager to know about the treatment that is being available in Guwahati. So, what would you like to tell on that?
Those are what the infrastructure of the cancer treatment.
Now, the technologies are very advanced, so let's something.
I'm working in this field of oncology for almost like 12 years now. Almost like 12. What I have seen is there is a lot of advancement in the technology, yes, and I'm very proud that our Guwahati is also advancing with those technology. And I have worked in some other hospital in government facility. There are a lot of facilities, good facilities in government setup also, but in private, in the future centers, they are developing very good facilities of this mammography. And in our Health City Hospital, we have a comprehensive cancer care. Cancer care center. That includes, actually cancer is a multidisciplinary approach. Not only the surgeon, but there has to be a good radiologist to detect the disease, good pathologist to report the disease, and there is a good OT facility, and post-operation, most of the time we need radiation or chemotherapy facilities.
It's entire teamwork.
Yeah, entire teamwork actually. And in Health City Hospital, there is a very comprehensive center we have developed, and very advanced machine for even for the radiation. We have one of the best machine in the country. Only 6-7 centers, those two true beam machine, it is there. But I don't want to show only the private sectors, but there are some government sectors also. They are coming up with very good facilities for the treatment.
So there is treatment facilities available in Guwahati. So
the agony is that the patient come very late. They present very late. And with all these facilities available, but still the patient coming in a very advanced stage, very less thing to do. So what is the need of the hour? What is I should suggest to appeal to all the women that yes, not only for the breast cancer, there are some other also. You have to know about your
If
body.
you are not able to detect it, but at least if you find some problem, immediately you should go and diagnose it, and also to see a specialist so that you might have an idea that what exactly the problem is, so that the treatment can be started at the earliest. All right, doctor, we are really short of time. Okay. So if you have any kind of points to tell our viewers, and what kind of suggestions you would like to tell our viewers on the last note.
Yeah, what I suggest is that the need of the hour is you have to know about this October month. What I suggest, the World Health Organization, they coming up with this idea of breast cancer awareness among the women, because it's a #1 killer in women with cancer, and they coming out the idea of assuring the women about their breast cancer. And that's why this whole month of October we celebrate as a breast cancer awareness month, and there are a lot of activity going on, and the aim of all this activity is to aware the women about the breast cancer, that it's a disease, but if we can detect the disease in a very early stage, there is a cure to the disease. But if we come in a very advanced stage, there's a very less thing to do with the breast cancer.
Absolutely.
So, yeah, that is why. So you should all aware of the disease. There are treatment facilities, there expertise are there, but it's your part is to come to the approach to the doctor or the healthcare facility in an early stage. That is what I suggest.
All right. Thank you so much, Dr. Pankaj Deka, for giving us time and sharing those valuable inputs to our viewers out there. And I'm sure viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.